modified Fox pentagon technique, which I learned from the YouTube videos by Dr. Susan Jacob. What we have seen is, in addition to the congenital ptosis, we have also seen very good results in adult ptosis as well. People who presented late. So this single stab has an additional effect that the inflammation is very less post-op. Besides this silicone string, when one can also use a true con, that's even more useful.
बदरिया घेरी आई नंदी, बदरिया घेरी आई नंदी.
Thank you so much.
Thank you. Over to the judges, please.
What was your post-operatively? There was no problem. Patient was happy?
Post-operatively, sir, for a single day, even we do not even give a patch after surgery, so that the person can have the mobility retained. And for a single day or for day 2, we have a little swelling, and then it's okay.
After ptosis correction, what defect was still there?
In some people, we have seen that this sling doesn't suit, so it causes a small granuloma over there. In few people, we had to remove it out and replace it with a proline thread.
Anyway, you did a very good job.
It is really very
You
nice
use this
procedure.
straight needle, right?
Yes, sir. It comes
As a straight
yes,
needle.
Yes.
So how did you make sure that you actually get that pentagonal kind of a track?
We mark it, sir, with using
No,
a
but when you're marking it, but it may not actually, because straight needle is very hard to negotiate, it's a very long track.
It has a sharp cutting edge, sir. So that goes, it's not that difficult.
It will go straight, it will not follow the pentagonal shape. So how do you ensure that you get
वो
that?
जाता है, sir. It goes.
Suppose you have not been able to negotiate the Fox pentagon, and your needle has been extracted somewhere else.
So
because
that will.
it is malleable.
Yes, sir. That will
then
cause.
In that scenario, what would you do? Would you do the re-surgery on the same day, because you can have profuse bleeding, or will defer the surgery for a week or two? What is your take?
Sir, actually, it's very easy. We do it under local anesthesia, sir. It's very easy. It just needs a little bit of practice. It has never so happened that we had to defer surgery.
No, since you have negotiated the
Yes,
pentagon like this, so
Yes, sir.
many times you want to externalize the point and to some point, and it lies somewhere else.
No, we have to regulate it, sir. With a tooth forceps, it's easily we can achieve that, sir.
Okay.
So any post-operative exposure?
We have not seen overcorrection, but sometimes undercorrection happens, or even in cases when the child grows up, a little bit of correction may be needed, sir. Secondary correction.
Thank you.
Is there a deformity in the middle of the lid, a notching kind of a thing happening in some of the cases?
It's hardly there, sir. The pentagon is the modified Fox pentagon technique is especially done for that. It's hardly there.
Good. So I think it's a very well done surgery.
Thank you, Dr.
Thank you,
Behera.
sir.
Thank you very much. So